This is Abia COVID-19 update.
Abia COVID-19 update.
Events, religious activities, festivals, burials, and other gatherings are being cancelled. There is a public health reason for these measures. These cancellations help stop or slow down the spread of the disease and allows the healthcare providers access to care for patients over time. Now, cancelling events that are likely to draw crowds is an example of social and physical distancing. Social distancing is deliberately increasing the physical space between people and avoiding spreading illness. Staying at least 6 feet away, that's 2 meters from other people, lessens your chances of catching COVID-19. Social distancing is important because coronavirus spreads when an infected person coughs, small droplets packed with the virus into the air. Now, these can be breathed in or can cause an infection if you touch a surface they have landed on and then touch your face with unwashed hands. Now, you know, one of the reasons washing of hands regularly with soap and water for at least 20 seconds is recommended, or you make it of alcohol-based hand sanitizer. The reality of COVID-19 stares us in the face. Our lives have changed, but this time shall definitely pass. Stay alive and take responsibility. This is Abia State COVID-19 update, the second edition for the week. Welcome to the program. My name is Michael Oni. Here we highlight daily reports of the Interministerial Committee on the Control of COVID-19 as well as Abia State Governor Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, from Mondays through Fridays on several radio stations in Abia State, live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Bose 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now, before we go straight into the conversation today, let's take a look at the situation globally. As of 7 a.m., 28th of April 2020, that's today, the outbreak of the coronavirus disease had been confirmed in around 210 countries or territories, and the virus had infected over 3 million people worldwide, and the number of deaths had totaled over 200,000. That's about 211,000, while 923,000 people have recovered. Now, the most severely affected countries include the United States, Italy, and Spain. With the United States, over 1 million people have been infected, confirmed with coronavirus, but 56,000 of them have been recorded dead, leaving the United States with about 814,000 active cases, with 139,000 persons recovered. Now, Nigeria's tally of the confirmed COVID-19 cases rose to 1,337 yesterday, and of these, 255 infected people have recovered and have been discharged, and 40 deaths have been recorded in 32 states and the Federal Capital Territory. 64 new cases were reported in 5 states yesterday. That's Lagos, Federal Capital Territory, Borno, Taraba, and Gombe State. And back home here in Abia State, we have 2 confirmed cases and 2 active cases of COVID-19, both at the Federal Medical Center in Umuahia. Both patients are above 70 years with underlying illnesses, but are currently stable and responding to treatment. But this morning, we have the Honorable Commissioner for Health in Abia State joining us this morning, Dr. Joe Osuji. Honorable Commissioner, it's glad to have you join us this morning despite your very busy schedule.
Thank you very much.
Well, we want to know the latest as far as COVID-19 is concerned in Abia State. What is the latest? We have 2 confirmed cases. What is the latest concerning those 2 confirmed cases at the Federal Medical Center in Umuahia?
Yeah. The 2 indexed patients at Federal Medical Center, Isolation Center, Umuahia, are all doing well. They are
Okay.
responding to different modalities of treatment that are being given. But the repeated laboratory result carried out on them showed negativity.
Okay.
Showed negativity. We have also collected samples again and sent to laboratory yesterday to see what happens with the results. If the results come out negative again,
Okay.
then those patients can be discharged home.
So
And
we
we'll
can
now
then
have to now talk about how did this positivity come about.
So we can then say Abia State is on the course of having no case of coronavirus.
Definitely.
What about the contact tracing, Honorable Commissioner?
Well, we have we've had a contact listing of about 262,
Okay.
and we are all following up the cases. They are not. We collected samples from a lot of them, about 23, 24 samples, and they all returned negative.
What about the rest?
The wife of the man, the indexed case, and the daughter and son of the indexed woman also came out negative. So we are thanking God that we're on the path of glory.
But the question that is on ground now is how they got the virus. We're scared that it might be a case of community transmission since they do not have a travel history. Now the question is, did you find out where they got the virus?
That is the case under investigation now. So because all the contact tracing we've done at Okwa, Ikuano and Omahia, they've been negative. So, and the repeated results came out negative on the two index cases. We have sent for another laboratory investigations on them again, waiting for the results. Maybe by tomorrow the results will come up and we'll not know. If they remain negative, then the patients are due for discharge, and we'll now follow up where did they get this in. Is it as a result of laboratory errors or
Okay.
whatever?
Okay.
So that is left for the
All right.
other.
We have a correspondent on the streets joining us this morning to monitor the level of compliance, talking about the curfew and also the lockdown in Abia State. We have someone that will join us all the way from Abba, and also someone that will join us all the way from Umuahia, the capital of Abia State. But we still have the Honorable Commissioner for Health right here in the studio, Dr. Joe Osuji. And of course, I want to ask you, Honorable Commissioner, the number of tests carried out already in Nigeria, do you have the number, the figures now?
It should be about, not quite clear, it should be about I think about 16,000 something, about that.
Okay, the number of tests
Done.
done in Abia.
So about that. No, not in Abia.
Okay,
I'm talking about in Nigeria.
Okay, I'm talking about Abia State.
Okay, for now, we have about 68 samples collected and test result come out.
Okay, and they came out negative.
Yes.
Just 2 came out positive.
Yes.
All right. Hello, good morning to you.
Good morning, Michael.
All right, we have Chioma Nkwonta on the streets of Umuahia, the capital of Abia State, monitoring the level of compliance of the lockdown. Chioma, can you confirm your location?
Well, right now we are at the High Court in Umuahia,
All right.
where we just witnessed the inauguration of the judges for the mobile High Court, for the mobile court that would enforce the implementation of the directives of Abia State Governor Dr. Victor Okezie-Ikpeazu. Now, the courts, which would be in the Z senatorial zone, were inaugurated by the Honorable Chief Judge of Abia State, Justice Onoha Ogwe. Well, right now we'll be speaking to the Secretary to the Abia State Government, that is Barrister Chris Ezin. Good morning, sir.
Morning, Choma.
Okay, quickly, can you tell us about the composition of the committee?
which of the committee?
About the mobile court.
Mobile court committees are headed by magistrates. From the other state judiciary, you have one heading Abia, you have one heading Umuahia, and you have one heading Ohafia. And they have administrative staffs to work with them, while we have prosecutors from Ministry of Justice to prosecute offenders.
So specifically, what are the functions of the mobile court?
Very simple and straight. You will agree with me that we have lockdown directives, we have COVID directives, dusk to dawn, and you will equally agree with me that if you pass through the streets of Umuahia all the way to Abia, the way to Ohafia, you have people still defaulting these directives. So the only way to get it enforced is to set up these mobile courts, which has not been done today. Mobile courts will have to arraign anybody arrested by the law enforcement agencies and the enforcement teams, both from the state and the local government level. They have to arraign these offenders before the mobile courts, and the mobile courts will deal with them accordingly. We are pretty sure that as soon as mobile courts start sitting right here, I believe they are on their way to their various locations, and then we'll start implementing these directives and then dealing with alien offenders. I'm sure every other person will sit up.
So how long will it take for an offender to be sentenced?
Is summary trial. What's called summary trial. Summary trial.
What kind of penalties would be meted out?
Fine, and community work. We are not no custodial sentence. You had the directive of the CJ during the inauguration. No custodial sentence. Fine, and you send out to community labor.
And who is going to monitor those that will be sent out for community labor?
The enforcement teams will do that.
Thank you so much. Thank you very, very much. Over to you, Michael.
All right. Thank you very much, Chioma there. Like you heard her very well, and of course, she had a conversation with the secretary to the state government, Barrister Chris Ezem, who doubles as the chairman of the Interministerial Committee on COVID-19 in Abia State. The inauguration of the mobile courts in Abia State just took place at the premises of the High Court. We will cross over to Abia to monitor the lockdown also there in Abia, the level of compliance. So getting across to Stanley Umba there on the street of Abia, the commercial capital of Abia State. But we still have the Honorable Commissioner for Health in the studio. We want to know how we can bury the cases of COVID-19 in Abia State, and of course to get some of the precautionary measures from the Honorable Commissioner. But we have Stanley standing by now. Stanley, good morning to you.
Good morning to you.
Okay, Stanley, you're welcome. Glad
Hello,
to have you join us. Yes, I can hear you loud and clear.
I can hear you.
Can you hear me?
I can hear you loud and clear.
All right, great. So what is the level of compliance there in the commercial capital of Abia State?
Well, you already know what ABBA stands for. You already said it as the commercial hub here. The situation is a bit better from what it used to be, but I will tell you the compliance is not really 100%. People are moving around. Yes, one good thing is a lot of them are really covering their nose and the mouth, making sure they respond to the call by government. But then vehicles are still moving around from one spot to another. I won't say all of them are really those allowed to, but people are moving. There's this level of movement. But then this morning I saw the Commissioner for Environment doing his job, various checkpoints trying to stop people and enlighten people on the right thing to do. But then when the security people want to pass, people will continue their normal movement. But this is about to do. But then one thing that's really reached them so deeply is the curfew. Before 6 p.m., people will go home because they know what it's going to turn to. Police men will definitely do a lot with them. We want to arrest quite a number of them, a handful of them. That's where getting a bit of concern, that aspect of arresting them, packing them in buses, packing them in a wheel of the truck. It's been a major effort because this issue of social distancing is not observed each time arrests are made. But generally, the curfew is working here in Abia. But it struck me. I am not quite pleased with the level of compliance. during the day. Cars are moving. People
All right, Stanley. Stanley, in the scale of 1 to 10, can you rate the level of compliance there in Abba? In the scale of 1 to 10.
1 to 10, I'll rate it 4.5.
4.5.
In the morning, it's 4.5 in the morning to this moment. But in the next probably 1 hour, when every checkpoint is totally blocked, you discover that the level of compliance will increase. The morning is always very poor, but as the day, as the day goes by, you discover that from 1 o'clock, it seems the security agencies are more active. But I must commend the task force, especially those from local government and so on, that of Danny and the rest of them. They've been quite awesome, stopping vehicles, clearing vehicles, and ensuring they keep them or they move them away from various points. I tried my best running around the city, really observing what we just asked of right now. The complaint is always increasing around 1, 2, but in the morning there's this level of movement, and I'm worried about that.
Thank you very much, Stanley, for the update. Now, we still have the Honorable Commissioner. I would like the Honorable Commissioner to highlight some of the importance of these policies put in place by this administration to ensure and to curtail the spread of this virus. For example, the social distancing or the physical distancing, and also reasons we should stay at home at this time.
Yeah, thank you very much. There have been numerous cases of community transmissions, and because of the community transmissions of these cases, you now discover that most people within the community have the virus and incubate the virus in them. Not a case of somebody coming out, into the community from outside the country. Now it's within the community. So we'll try as much as possible to do this lockdown, make the introduction of face masks, that every person must wear a face mask. Then social distancing should be observed, and personal and environmental hygiene should be utmost to at least try as much as possible to curtail the spread of this pandemic.
Interesting. Let's open the phone lines now. We want to hear from you. I know you have a whole lot of questions to ask the Honorable Commissioner for Health in Abia State. The lines are 0808 182 6949 or 0811 605 2949. Also drop messages on 0906 510 8289. It is Abia State COVID-19 update.
This is Abia COVID-19 update.
Abia COVID-19 update.
Good morning to you.
Morning.
Yes, good morning.
This is
Can you speak up, please? Okay, I can barely hear you. Please do call back. Hello, good morning to you.
Good morning. Good morning.
Good morning. Yes, what's your name?
Good morning, Honorable Commissioner for Health.
You're welcome. Good morning. Go ahead.
Okay. Who's someone know that I'm calling from Omai?
Welcome.
Please, I want to applaud the Commissioner and the state government, Abia state government, on their effort and proactive measures being put in place for this pandemic that is ravaging the whole world. I still encourage them to do more on the issue of palliative. I just pray, Honorable Commissioner, please, people can extend my greeting to the governor. He should, he's trying anyway, he's trying his best to make sure that others are ready. And I'm still using this opportunity to encourage Abians to observe social distancing and pray. Because there's nothing like this. That prayer, God is bigger than coronavirus.
All right, wrap up your thoughts, please. Thank you very much. Hello, good morning to you.
Hello, good morning.
You're welcome.
Yeah. Just in a
Can you speak up, please?
Yeah, that's just in a
You're welcome.
Yeah, Michael, I called you last night. I was telling you about the palliative, and you said I should send number to your message. I do justice to that.
All right, we have you have the opportunity to ask questions concerning COVID-19 in Abia State. We have the Honorable Commissioner for Health, Dr. Joe Osuji, right in the studio. Hello, good morning to you.
Michael, good morning.
Good morning.
This is Noble Kodaka. I'm calling from Umuawa in Umuahia, South Asia.
You're welcome.
Honorable, good morning, sir.
Yeah, good morning.
Thank you, sir. A little question I have. I'm very happy this morning when you said that the 2 index case we have in Abia State are trying to test negative. I pray let it be like that. But I want to know, you complain of laboratory error. How many times did they lab these people before they confirm that it is COVID-19 patient? Thank you.
Okay, did you get that?
Yeah, thank you very much. We're not supposed to have laboratory error for now. Any result that emanates from the laboratory set up by the NCDC is termed authentic. But a situation where we have in the state now, where we sent samples, 2 came back positive, we repeated the samples to another place, it came out negative. We have sent samples again to the first lab, waiting for the result. Assuming the result, come out negative, we'll now ask ourselves a question: where is the problem coming from? Is it a misplaced result or whatever? That question is left for the next hour.
How soon are we to have a testing center in Abia State?
The government is trying its best to install a molecular lab in the state, and once that is done, then we can now start testing.
Okay, let's get more reactions. Good morning to you. Hello, good morning.
Hello, good morning.
Good morning.
Thank you. My name is Ugonna.
Ogona, you're welcome.
Yes, so let me appreciate what has been done so far. But most importantly, let me appreciate the resilience of Nigerians, the generality of the populace, the hoi polloi, the downtrodden, the poor, the widows, for the effort they have made to withstand the pandemic. As a matter of fact, I got curious at the point that Nigeria as a country and others in states lack specific data to know whether our population and they distribute things as if we have only 10% in a state. If we were to rely on the distribution of what they call palliatives, I'm telling you, the entire country would have been wiped out. So I want to appreciate the tenacity of all Nigerians who have fought hard.
So what is your question, Ogona? What is your question?
The question is, how can they be distributing just palliatory things in the name of palliative? How many persons can he specifically say that these things are gotten to? And to what extent will he carry people over the past 3 months, weeks that this thing has been on?
All right, thank you for your question. Honorable Commissioner.
Yes.
The issue of palliatives, I know it's not on your table, it falls on the table of the chairman of the committee, but you can also respond since you're here and you're a member of the committee.
I'm not a member of the committee for palliatives.
Okay.
So it's for Honorable Commissioner for information, right, to respond to that.
All right. We will pen your question down, Ugona, and of course put it to the right, to the appropriate quarters. Hello, good morning to you. Hello. Hello, good morning. Okay, we lost that. Keep your calls coming. 0808 182 6949 or 0811 605 2949. Hello, good morning to you. Hello, good morning. You're live on radio. Good morning. Good morning to you.
Morning.
Can you speak up, please? Good morning.
Hello?
Good morning. I can hear you.
Hello?
Hello, good morning to you.
Good morning, Mike.
You're welcome. Good morning.
Good morning, my honorable commissioner.
Good morning.
My question and
what's your name, please?
I know you are in
your
charge.
name?
What is the plan for the health workers who will be assisting you and volunteer and be doing the job? Because we have been hearing in some other states they be complaining that they are not giving them the allowance to give. Even in the president's statement yesterday, we were expecting him to come up and say, okay, this is what is going to happen, but he just say it in a partial form. It's not that kind of encouraging and vetting. And besides, we hear about over 40,000 or 40 people, 40 workers have died. What is the parameter you are taking now so that something will not occur in other states? That's my question. Thank you.
All right.
Yeah, thank you very much. We are taking every precautionary measures to ensure that we condone the pandemic and contain it. The precautions you've given, that you observe distancing, try as much as possible to observe strict personal and environmental hygiene, report cases that you observe are not normal to the health authorities, and again, try as much as possible to give aid to the needy. So, if you observe this and take these precautions, the pandemic will not spread into Abia and beyond.
Is there a special treatment for the health workers, the frontline health workers in charge of this pandemic? Talking about a special allowance, probably hazard allowance, especially for those in Abia State.
Yes. You know, the president said it yesterday that there has to be a hazard allowance, earmarked for these frontline health workers, and which actually we're going to start immediately. Otherwise, other palliatives are given to them, other incentives are given to them.
How many isolation centers do we have in Abia State?
We have 3 isolation centers. One at Federal Medical Center, Umahia, the Specialist Hospital, Amachara, and again, the Infectious Disease Hospital, Abba.
All right. I want to really appreciate you this morning for being part of the program, Honorable Commissioner for Health in Abia State, Dr. Joe Osuji. Thank you very much for your time. All right, that's how far we can go this morning on the program. Abia State COVID-19 update. It's live on BCA 88.1 FM, Flow 94.9 FM, Bose 89.7 FM, Real 99.1 FM, and Vision Africa Radio 104.1 FM. The program returns tomorrow. My name is Michael Oni. Do enjoy the rest of your day.
This is Abia COVID-19 update.
Abia COVID-19 update.